What's up, guys? Carl here, No Bull Training. I have the answer for all your shoulder pain. Actually, I don't. But a lot of these are out there dealing with shoulder pain, and I'm gonna let you know why. For the most part, your rotator cuffs, the sits muscles, it's an acronym. Supraspinatus, infraspinatus, teres minor, subscapularis, your rotator cuffs. I'm gonna be quizzing you later this week, so write that down. So guys, seriously, we already have a muscular imbalance. Your pecs, your pectoralis major, massive, heavy, strong, thick muscle. Your lats, latissimus dorsi, internally rotate the shoulder. Your anterior delt, also a strong muscle on its own. All three of those internally rotate, among a few others. But just to keep this simple, internal rotation, very powerful. Think of arm wrestling, you're winning the arm wrestling match. What decelerates or what externally rotates the shoulder? Posterior delt, it's no bigger than my two fingers. Teres minor, very small muscles. So we're already born with an imbalance. Unlike the hip, ball and socket, the shoulder is not a ball and socket. Think of a dinner plate and a basketball. It doesn't quite fit in right. It's a gift and a curse. It's a double-edged sword. It's why it has such great range of motion. Flexion, extension, abduction, bent arm abduction, internal rotation, external rotation, horizontal adduction, horizontal abduction. You name it, the shoulder does it. But it's why it's also susceptible to injury. So what happens is a lot of people we sit at desks, what I'm doing right now. We round out, we internally rotate. We've closed something called subacromial space. We shrug because we're tense all the time, because we're looking at phones. I'm guilty of it. We're looking at things. So we're already in bad posture. We already have a muscular imbalance. We already maybe perform certain movements improperly. Push-ups. Push-ups. I can't tell you how many times I see push-ups here, chin poke, shrugging. No good. If you want rotator cuff pain, go do push-ups like this versus this. What looks better? Immediately. So the head position matters, your trap position matters, your scapular position matters. But all this just adds insult to injury to an already imbalanced shoulder. So we have to train more pulling. We got to see more pull aparts, face pulls, Ys, scapular work, thoracic mobility work. It's okay to bench and shoulder press. We need that too, but we can't have such an imbalance. We need more low rows, more TRX rows, more chin-ups, more pull-ups, more lat pull-downs, more dumbbell rows. So we need things that open up our chest cavity, and we need the pec stretch more because we're getting into a position of this. We close that subacromial space, the supraspinatus now gets impinged. It rubs, it might take weeks, months, years, decades, but it starts to get inflamed, and then there's pain. If you work through that pain for long enough, you're gonna have rotator cuff surgery. So it doesn't happen overnight for the most part. I'm not saying there's never acute injuries to the shoulder, but it's almost always a chronic issue over time. So just think about the rotator cuffs. Think about that non-ball and socket. Think about getting better mobility before you add resistance. I can't tell you how many people I see that can't lift their arm over their head and they get a 40-pound dumbbell and try to press it. That's a bad idea. Get your mobility first. Strengthen the rotator cuffs. Do more pulling. Think about your posture, and it'll fix your rotator cuff issues. Give it a shot.